What is mental health?
Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence. Although the terms are often used interchangeably, poor mental health and mental illness are not the same things. A person can experience a poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of physical, mental, and social well-being. Mental health is everyone's business. We all have times when we feel down or stressed. Most of the time, those feelings pass, but sometimes they develop into a more serious problem, and that could happen to any one of us. There is a stigma attached to mental health problems. This means that people feel uncomfortable about them and don't talk about them too much. Many people don't even feel comfortable talking about their feelings, but it's healthy to know and say how you feel.
Why is it important? There's a lot of factors on why is mental health significant. It is important because it is anchored to our physical health. It helps us deal with stress. It makes us more productive in our everyday life. Mental health is important just like our physical health. Being mentally healthy can make changes in your lifestyle. It makes us more lively and more focused on what we are doing. That's why mental health is important.
Being mentally healthy helps us cope with stress. Having good mental health can make us calm and focus on how to manage our stress. Being mentally healthy can give us good relationships, especially to our parents and family. You can now have a good relationship with them by talking to them and bonding with them. Being mentally healthy can make us work productively every day. We can finish our task even before the deadline.
Serious mental illness or include anxiety disorders, eating disorders, and personality disorders if the degree of functional impairment is severe. Serious mental illnesses includes schizophrenia, spectrum disorders, severe bipolar disorder, and severe major depression.
Depending on the diagnosis, circumstances, and other factors, the signs and symptoms of mental illness might vary. Emotions, beliefs, and behaviors can all be affected by mental illness symptoms. Here are examples of mental illness symptoms: feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends and activities, detachment from reality or delusions, paranoia or hallucinations, significant tiredness, low energy or problems sleeping, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, major changes in eating habits, problems with alcohol or drug use, excessive anger, hostility or violence, sex drive changes, and suicidal thinking. If you have any signs or symptoms of mental illness, you have to go see a mental health professional, because if this mental illness remains untreated, it will get worse over time and may cause you serious problems.
Mental health problems can cover a broad range of disorders, but the common characteristic is that they all affect the affected person's personality, thoughts, or social interactions. According to World Health Organization, 15% of people around the world suffer from a form of mental illness, and 5% suffer from a disorder severe enough to affect school, work, and other aspects of daily life. Some of the effects of mental illness to an individual are inability to remain focused on task and having an impulsive behavior, repeated attacks of intense fear, sadness, and irritability, inability to cope with daily problems or stress, losing interest in hobbies, and dramatic changes in eating pattern.
5 ways to deal with mental health stigma.
Are not your illness. Convince yourself first that you are not a person, not a walking illness. Educate yourself and others. Knowledge is power. Take every opportunity to educate people regarding mental illness, symptoms, and treatment. You are not a switch. There's no on and off switch function in our mind. You cannot turn off your illness. You can control it without help. Do not believe it. Try not to let other people's ignorance influence the way you feel about yourself. Get mental treatment you need. Treatment is vital in bringing relief and reducing symptoms that interfere with life. Try not to let the fear of being labeled with mental illness stop you from getting help.
Here are the 10 things you can do to boost your mental health, mind, and body. Look after your body as well as your mind. Eat a well-balanced diet, keep hydrated, and get into a regular sleep pattern. Exercise. Engage in regular exercise. Find a sport or activity that you enjoy. Organization. Manage your time effectively. Stay organized and on top of things. Self-care. Practice self-care. Make sure to look after yourself, relax, smile, have a bath, go for a walk, and do something you enjoy. Talk to someone. Don't be afraid to talk to someone about how you are feeling. Talk to your friends, family, or teachers.
Is breathing. Learn how to breathe effectively. Practice a number of techniques and find what works for you, like brachial breathing, deep breathing, and progressive muscle relaxation. Then number 7 is write down. Write down how you feel or what you are thinking. This can be a really simple way to understand what is going on inside your mind. Then number 8 is challenge. Try to challenge your thinking. If you experience an unhelpful thought, try and turn it into a helpful thought. Then number 9 is check in. Regularly check in with yourself. Monitor your emotions and mood. And last but not the least is problem solving. Learn how to problem solve effectively. When you experience a problem, try to write it down with number of solutions.